I am Sandra, medical health officer. I'm a settler, colonial Eastern European woman. My mom is Czech and my dad is Ukrainian. I'm from Manitoba, grew up on the prairies. So I really find I'm privileged to find myself here in Nanaimo. The fellow before me, you all know him, Paul Hasselback. I met him first in 2009 when I was a resident in public health medicine in Manitoba. He came to Manitoba for a conference and was looking for residents to help out, and that's when I first met him. And even though he's retired, he sent me a note this morning asking me to do something. So I feel like I'm still the resident that I met when I met him 12 years ago, but here I am. So prior to the pandemic, we were worried about sedentary behavior, loneliness, isolation. And what we know about isolation and loneliness is that, well, for sure, lots of people are socially isolated. And social isolation means that you lack social connections. And loneliness means that you feel that you don't have a connection to anyone or you're feeling lonely. You can lack social connection and not feel lonely. And you can have social connections and still feel lonely. But being socially disconnected and lacking social connection and feeling lonely, about 1 in 5 seniors feels that way. And interestingly, when you survey people, there is some element of shame and a vulnerability to saying I'm lonely, that people underreport loneliness. And so that's something that's really important to acknowledge, that people don't want to tell you they're lonely. They just want connection, and they don't want people to, they don't want them to know. And so the health risks of loneliness and then compounded by sedentary behavior, because if you're lonely and socially disconnected and you're at home, you're certainly not walking around the block maybe, or maybe you're not marching around your house. So those impacts to your cardiovascular health, diabetes, obesity, obviously, issues around mental health, the health promoting aspects of having social connection. We are social creatures, absolutely. And without social connection, we know in early childhood, I know Helene is here, I know the group here has done amazing work in the early years. We absolutely know that children who do not have connection in early life dwindle and die. Like, that is for sure. So we as humans need connection. Over the pandemic, we've surveyed across the province on BC, the COVID Speak survey. There's a dashboard on the BC Centre for Disease Control. And it was just pulling out some certain aspects around what people are saying about their health, their wellness. And people are concerned for their own health and the health of their family members. Some of them have either been avoiding their family physician or they find it difficult to access a family physician. Many of them have decreased their physical activity and they're sleeping less, despite us knowing that that's extremely important. Some have been increasing their fruit and vegetable intake, and some report walking and running more. Regarding our mental health, across the board, people have a reported increased sense of stress and worry. Many people have increased their alcohol or other substance use. People are reporting that they're preoccupied with coronavirus and they do have difficulty not thinking about it. Many of them have difficulty accessing counseling. Regarding those important social connections, they're incredibly important to our health. Many people have reported a greater loss of connection with friends and family. Unfortunately, we are seeing increases in gender-based violence over this time. And during times of isolation and lockdown, people who experience intimate partner violence are often placed in close proximity with very few resources in communities. So very difficult times are being reported, and we'll only see after the fact when those data become available. The supports that we get and that resilience from having a supportive relationship really have been missed in offsetting the stress and anxiety. But we do have, in some situations, people reporting a greater sense of connection to community. And for some women, they have reported an increasing connection with more friends. So today I am going to speak about social prescribing, because as I was thinking into the spring that we would maybe be recovering over the fall, how, maybe it was some premature thinking that we'd be fully into recovery by the time school came, and we're still dealing with that right now. But nevertheless, planning ahead is always important. we know that the impacts I described are not getting any better. I learned about social prescribing first from a colleague friend in Ontario, and this was long before pandemic. Social prescribing has been around for decades, and the UK has been working in the space since the early 90s. And so, really, it has even come across the planning tables in British Columbia in past decades, but it's been resurfacing, particularly in the last 10 or 15 years, because of the applicability to certain populations. And social prescribing really seeks to enable primary care professionals, that's not necessarily the physician only, but anybody working in that primary healthcare space, to refer people to a range of non-clinical services. So things that help people become more connected in their community, addressing their health and wellness more holistically. What they call in a social prescribing scheme, and this graphic is from the Making Sense of Social Prescribing, and it's from the University of Westminster in the UK, and they've been working in the space for quite a while. I like how they articulate just some key components of what social prescribing is, and that includes a health professional, and I mentioned it doesn't need to be a physician, it could be anybody who's working with a client. And then a link worker, and we've been using words like navigator, a social prescribing liaison. And then the last component that's incredibly necessary, and I see a really important role for OWN and other community health networks here, is a range of local, voluntary, community, and social enterprise groups, which a person can be referred to. Social prescribing supports mental, emotional, and practical needs. They improve well-being and physical, mental well-being, as well as emotional well-being. It leads to positive health outcomes, and I have a few of those to point out. And to be honest, it provides real time to guide both public health interventions and community planning, and supports some important developments in community to guide to meet the needs of community members. In Ontario, there's an excellent report that was done from the community health centres. They've a bit ahead of us in the community health centre space in the province of BC, especially with regard to social prescribing. And they've described this, which is very similar to the schema from the UK, which is that there's an individual that has social and medical needs, and the physician can try and meet those medical needs, but certainly the social needs become harder and harder to meet, but yet they can drive some of the health needs. The prescriber, when enabled in a social prescribing scheme, can identify non-medical needs and make a social prescription and a referral. And that's onward to that link person, a social prescribing navigator or liaison, which connects an individual to appropriate resources based on self-identified interests and needs, and supports their journey to well-being. And a social prescription is defined for that individual that connects them to social and community supports with an invitation to engage, co-create, and give back. In some of the neat projects that I've heard of in Ontario, and it's just a basic example, someone in a small community wanting to play chess, but there wasn't a chess club. And so he became a social prescribing champion and was unable to create a chess club. And then people who were interested in chess then had somewhere to go. And so it's just those type of initiatives and providing that space for someone to be able to do that. The health and wellness benefits of social prescribing are really being more well fleshed out, but I think some of them are intuitive and some of them just seem like common sense. We know that those physical and emotional well-being really are spin-offs from social connection. So the improved resilience and that self-esteem and confidence that comes with connecting with others. Having different behaviors because you have something different to do. You can modify behaviors through introducing new lifestyle habits, new activities, but even through social connection, you can introduce more self-regulation and you have better ways of coping. The opportunities that social prescribing provides at a community level are really important. It bolsters the voluntary community and social enterprise efforts of a community and really enhances that social infrastructure. And we know that over the years, as we've designed ourselves into smaller communities and into nuclear homes, we've lost some of that social infrastructure. And we know that some of the social prescribing projects directly impact the social determinants of health through either income prescribing or other sort of opportunities to just direct individuals to resources like housing. I want to reflect that this is not necessarily all new. As I mentioned, in the UK, they've been at this for a long time, but similarly within the province, the Prescription for Health initiative was, implemented between the years of 2011 and 2014. And it really was an opportunity for physicians to prescribe physical activity. Within Nanaimo, there was the Seniors Connect, which was an opportunity to connect seniors to different resources. I wasn't here in 2015 to 2018. Maybe some of you know of that project. The integrated health networks within 2008 and onward really did seek to try and strengthen the opportunities for the community sector in the health and wellness of the community. And certainly some of these try to address the determinants of health more broadly. The BC Health Links 211, excellent resource for people to be connected to community resources virtually. And that's something somebody would do actively and on their own. However, the social prescribing does provide that hands-on opportunity. Some of the work that we're thinking of in the region regarding social prescribing is within the context of primary care networks and community health centers. We know that some of this activity is already underway. Some of the social prescribing projects that are, really proper social prescribing, and other ones that might be just similar or social prescribing like. We have a CIHR grant application that's been submitted for a Catalyst grant to do an evaluation of the existing programs in Island Health Region to understand what's working, what can be spread elsewhere, how do we maximize some of those learnings and opportunities elsewhere. So along with that, we're developing a community of practice for those of social prescribing interest. And so we'll be advertising that and promoting that to help people get connected through a social prescribing community of practice on the island. Other projects that are directly influencing some of those determinants of health are things such as food prescription boxes, and together with the physical activity prescribing in Nanaimo, that is one of the focuses of the evaluation project. The income prescribing in the Cowichan Valley area, that is the focus of our evaluation as well. So that's it. I just want to wrap it up there. I'm really interested in hearing from the community and from participants today in the breakout rooms what you know about social prescribing. Maybe you've been at these tables before. It's no surprise to any of us that the same themes come around in healthcare once every 10 years or so. And so maybe you're back to an old topic that was a favorite. Maybe you have some old ideas. Some old projects. Maybe you have some opportunities that you'd like to share with the larger group. And as we go forward in discussions with the Division of Family Practice in the Central Island area, which services both Port Alberni and the Oceanside area, I know the physicians in the division are very interested in hearing more about this work, as are my teammates in Island Health. Island Health team members that are working in the seniors program. I met with them yesterday, and Dory mentioned that social prescribing is on her 5-year work plan, starting 2021 to 2026. So I'm really excited that we're right at the front door of this, the community sector being activated to start working in this to help people become more engaged in community on the tailwinds of the pandemic brings me a lot of hope for how the population might recover from this. So I'll stop talking now. Thank you so much for everything you do, and I'm happy to answer any questions, or we'll just proceed into some small group discussions.